talk about hard acts to follow. Yeah, my name's Ian Bond. The company's called Medivation, and I'd like to talk to you about our app, ibe.mapp. If you hear any heavy breathing during this presentation, it's me. I have COPD, chronic obstructive pulmonary disease. But I'm not on my own, so do a million others in the UK. And if you pay national insurance contributions in this country, I'd like to thank you, because you're subsidising me for drugs, GP visits, hospital visits, specialists, scans, to the tune of about £2,000 a year. So I've chosen to do this the easy way, I hope you'll understand, with a video.
$1 million plus 3 million suspected undiagnosed in the UK, 30 million in North America, and probably the same in the EU, and that's just the West. The burden on health services is immense. Third largest cause of emergency hospitalisation sometimes. And it's a huge burden on individuals, their families, and society overall. So it makes sense that anything that can have a positive effect on the situation has to be good news. Well, I've got some. The good news is ibe.mapp. It's an app for mobile devices. And ibe.mapp will deliver improved well-being, better patient engagement, and improved compliance with medication. The lack of engagement and compliance makes it so easy for people to fall into lethargy, despair, and depression, adding to the problem in so many ways. But I'm told authoritatively, pharmacists only issue on average 10 of the 13 expected prescriptions for patients each year. So many are not even taking their medications. And ibe.mapp will have an effect right there. It will have a positive effect on wellness, drug waste, improve dialogue with clinicians, free up valuable GP time and hospital beds. It delivers proven healthcare. So let me tell you how this has come about. I started to keep a detailed diary of peak blood readings. I then expanded this with my medications, the changes in my medications and dosages, and then began to score my wellness each morning across several domains: breathlessness, asthma attacks, nasal conditions, infections, coughing, exercise, sleep, and sleep is so important. And of course my peak flow readings and other related, age-related issues I won't go into. So these are my meds, not untypical. And this is an example of my diary sheet. It looks complex, but only takes 20 seconds morning and evening to do this, while I'm taking my medication anyway. Ticking boxes, rating 1 to 5. And the results were soon impressive. I could see relationships, I could see correlations. I started to confront my condition twice a day. And now when I see a specialist and he asks how it's been for the last few months, the answer isn't not too bad. I can tell them exactly how it's been and why. I've got a far better engagement with my condition. I can give my GP and specialists real feedback, real data. And of course you can see where all this is going. I might be a bit of a dinosaur, I'm well into my 70s, but even I can see that this was quite absolute technology. An app with user-friendly front ends to suit the various generations, and a secure data management back end. Personalised for each condition by the pharmacist, chest nurse and the doctor. The patients themselves will become more engaged with their condition as they see the results of it. And they can take that report into their doctor and have the same meaningful conversations that I do. And the next step's obvious too. Give my doctor or the community pharmacist the ability to see my data 24/7 online. Give professionals the opportunity to examine their entire patient cohort at any time and see how we're doing. Do we need that scheduled review? Or can it be skipped because I'm doing okay? Is that new drug working? Am I taking my drugs regularly? Am I exercising? Does the doctor want to increase the puffs of the inhaler? You can tell me the message if he so chooses, because the system is two-way. Options for support messages and education. We can motivate smokers with education and YouTube links. And here's another thing. If my peak flow readings are starting to fall off a cliff, as they did here, and my sleep interruptions are, the alarm will be sent out, bells will ring. The doctor can deal with the situation before it becomes an emergency, with ambulances, A&E and hospital beds involved. Then, let the system capture ambient data as well. Temperature, air quality, pollen for each area, all very significant for lung condition. Aggregate them all, anonymise, big data, make it accessible to health services also. And it's for all of these reasons and the personal benefits to the patients that the British Lung Foundation have taken a serious interest in this project. The system is easily scalable to allow other e-health services to be bolted on, addressing migraine, early intervention mother and baby programs, diabetes, prostate. So, ibe.mapp really is good news.
So the build of ibe.mapp starts this week. The concept phase is over. We'll have the first versions into user testing with British Lung Foundation's user groups by April, May. We'll be starting to employ technical developers pretty soon afterwards in June. And that will be the beginnings of a program of innovative development where we see that we can go towards a family wellness hub, not just COPD. If you like what you've seen, and if you're interested in partnerships, investment, or just knowing how we're doing, please fill out the reply form, which is on your desk. And I want to give a nod to the Life Science Hub here. We're very much a startup company, a very small startup company. Big ideas, a long way to go. But within 2 months of joining the hub, we find ourselves addressing an international audience. Can't get much better than that. Thank you very much.